Hi, I'm Dan Stradford, the president of Safe Harbor and our website, alternativementalhealth.com. Our mission is to educate the public, the medical field, and government agencies about non-drug treatments in mental health. The video you're about to see covers alternative treatments for anxiety issues and for what is commonly called OCD or obsessive compulsive disorder. We're going to look at alternative treatments for anxiety spectrum disorders, including OCD, which is obsessive compulsive disorder. These are conditions of chronic or recurring anxiety that basically cause an individual to have great difficulty functioning in their day-to-day living. Anxiety has many causes, and as with any mental disorder, it is important to identify those causes and treat them whenever possible in order to really bring the anxiety under control and ideally to eradicate it. The various causes, and we're going to go into each of these as the video goes on, are medical. That's a very common cause of anxiety problems. Diet can be a contributor to this. Medications can certainly be a big contributor to anxiety. Sleep disturbance or sleep disorders or lack of sleep can be a problem. Many aspects of lifestyle affect the person's calmness and can cause anxiety. There are metabolic issues, which we refer to as the Walsh Protocols. We will discuss those a little later, and they sort of fall under medical problems actually, but these are issues that can cause a person to be in a state of constant anxiety or repeated anxiety. Stress is the most common thing that people associate with anxiety and certainly can cause it. And there are environmental factors that contribute to an anxious state. There are well over 100, probably several hundred causes, medical causes for anxiety. And it's something that you get checked with. Anybody with any severe mental issue needs to get a full physical exam to determine if they are experiencing one or more of these issues that can be causing their anxiety. Some of these can cause chronic anxiety, some of it can cause intermittent anxiety, depending on what the issue is. Hyperthyroidism is a very common cause of anxiety. Several percent of the population, I don't know the exact number, probably 2 to 3% of the population has a hyperthyroid issue, and this is when the thyroid gland is overactive and basically speeding up the metabolism, and this causes a sense of like a racing heart or a sense of nervousness, hyper alertness, that sort of thing. So that's can be treated medically and can be handled that way. There are pesticides called organophosphates, which are commonly used. So farmers actually have an exposure to this, or gardeners who use a lot of this. That can be a source of anxiety. Low blood sugar. This can be intermittent, where a person's blood sugar drops below a certain point, or that can actually happen obviously to diabetics as well. When their blood sugar goes through some sort of a cycle. So diet can be used to improve that. Lead or mercury or manganese toxicity, these can cause anxiety issues. And so that's something that can be tested for and treated. Mitral valve prolapse, this is a heart issue, which, and anytime you have something that restricts blood flow or even restricts respiration. Actually, that is a whole separate subject. Anything that restricts respiration or breathing impacts that, and it results in a sense of anxiety. And so that is a mitral valve prolapse is actually common among certain people, and it's a very commonly causes anxiety. And again, I will go into breathing. Any breathing issue, asthma or that sort of thing, anything that tends to restrict the chest or restrict breathing can lead to a sense of nervousness and anxiousness. Menopause and premenstrual syndromes, these are usually hormonal shifts that can cause panic attacks and that sort of thing. So that's something to be considered if you're in that age area and you're suddenly feeling very anxious or having panic issues. Adrenal problems. This can also, the adrenal glands provide a boost of energy, and if they're on overload, then they're putting out too much and you feel too much energy, again, hyper alertness, and you can have a sense of nervousness or anxiety. Strep throat in childhood can cause what's called PANDAS, P-A-N-D-A-S, and it can, which stands for a disorder caused by strep throat, or the germ that causes strep, and it can result in OCD, or obsessive compulsive disorder, for children. So that's something to consider if a child suddenly is showing compulsive or obsessive behavior. There are many other medical conditions. These are simply a few of them, just to give you an idea that you do need to get checked out if you're having anxiety, chronic anxiety, and it is not letting up despite basic efforts to fix it. Diet is a big factor in mental health, and anxiety is can definitely be caused by a poor diet. It actually causes one to be prone to something like anxiety or depression. Too many carbohydrates, for most individuals, that can be a problem. Eating a lot of flour and breads and sugars and that sort of thing without sufficient protein can lead to blood sugar issues. There are a few individuals who do really well on high carbohydrate diets, but they're not in the majority. So for most people, again, too much sugar, white flour, that sort of thing can lead to some anxiety and depression. Lack of protein. Vegetarians sometimes are in this condition. Vegetarians also can be low in B12, which can cause anxiety. So a lack of protein could cause this. Too much sugar can cause, again, the blood sugar hypoglycemia can be an issue, or there can be other factors from too much sugar that can cause anxiety. A very common cause of anxiety is excess caffeine. People like their coffee and they find themselves getting jumpy later in the day. Sometimes they used to be able to tolerate caffeine, but now they can't, but they haven't spotted that fact. So if you've got some anxiety issues, or now that you've got anxiety, your ability to tolerate caffeine is much lower. If you've got anxiety issues, it's wise to taper down off the caffeine, because that usually makes it worse. Even if it's not causing the problem, it can worsen it. Excess alcohol can be a problem. Some people get quite anxious after drinking alcohol, or when they've got a hangover, or just from drinking alcohol, period. For some people, it can trigger some issues. So that's something to consider if you're having anxiety issues. Trans fatty acids. These are oils that are used in cooking certain foods that are processed foods, and they're used a little less these days, and they're on their way out in some industries, but they still can. They basically cause the cells to be a little more rigid. Some of the body cells, and they don't contribute to health. Let me put it simply that way. And anything that does not contribute to your health and detracts from your physical health can impact your mental health. So again, it's something that you should try to avoid. Low omega-3s. This is found in fish oil and flaxseed oils. Omega-3 fatty acids, and a diet that's low in those can result in depression, and greater depression and anxiety, and just general low mental health and physical health. Lack of fruits and vegetables. This is just, again, for good general health. That allows for good digestive action. There's plenty of vitamins and minerals in fruits and vegetables. Many reasons to eat them, and they cause a general improvement in how you feel, which again would tend to reduce your anxiety levels. Food allergies are something to strongly consider. If there are foods that you don't do well with and you've got anxiety issues, best to avoid those. Anything that's going to make you feel worse, it's best to avoid if you're having anxiety problems, if you can. And there are certain allergies that can actually be the direct cause. Latex allergies. This is allergic to rubber. There have been people with allergies to cat hair that have anxiety from that, or coffee for some people. There are numerous allergic reactions that people have that directly cause anxiety. There are lots of medications that can cause anxiety, so that's something to consider if you're trying to reduce possible sources. Epinephrine is something that people take sometimes for allergies or for asthma, and that can contribute to anxiety issues. Norepinephrine is another drug that can contribute to this. Ephedrine, that's been used for some people for dieting reasons and for other treatments, and that can also cause anxiety. Pseudoephedrine is another one. By the way, if you're on any medications, you should obviously consult your doctor before you discontinue taking any medications. But if these are contributing to your, or you can suspect they are, you can certainly take it up with your physician. Thyroid medications, the thyroid regulates the metabolism, as we mentioned, and there are medications that cause you to feel speeded up as a result, and that can cause you to feel nervous. There are lots of stimulants, and all of them, because they do stimulate, will also stimulate the nervous system, and they can be suspects in this. Nicotine, usually found in cigarettes, but it's also found in tobacco products, but it's also found in a few other things, and that should be that can cause anxiety, so should be considered as a source. All of these, by the way, if you're already anxious, these can just simply you can be much more sensitive to these than maybe the average person, so that has to be taken into consideration. Believe it or not, tranquilizers and antidepressants, which you would think would always calm you, do not always calm you. They can actually cause anxiety as well. And of course, withdrawing from drugs, a very common side effect of people, particularly coming off of psychiatric medication, is anxiety, even if they're trying to come off of something that's not an anti-anxiety agent. Coming off of antidepressants or antipsychotics can cause anxiety. So consider that if you've stopped taking a medication recently and you didn't anticipate that might be a problem, but drug withdrawal can be one of the issues. Sleep is a major consideration in healing from any mental issue or emotional issue. Obviously, lack of sleep can cause problems, and so it lowers your resistance, lowers your stress tolerance, and should be considered if you're having anxiety issues. Sleep apnea. This is an interesting condition whereby people snore. That's usually the most common symptoms is heavy snoring. They tend to stop breathing in their sleep. If you're a heavy snorer or you're waking up exhausted every day, and you believe you may be snoring, but you don't know if you live alone, you just don't know, it's worth being checked out for sleep apnea. If you have a partner, obviously this person can tell you if you're sleeping at night. If you don't have a partner, maybe you could record yourself for an hour after you go into sleep and consider that as a way of testing you. Sleep apnea can be adjusted. There are medical devices to fix this so that you can sleep better and get more rest. And it could be the source of depression and anxiety, and completely fix it if you can if that happens to be the source. There's a condition called restless legs, which causes people to kick around during their sleep or move their limbs, and this can actually lower the quality of sleep and cause you to wake up tired and you don't know why. Fixing this, you can treat it. There are medications for it which are dubious, but they do treat it. There are some natural treatments. Calcium and magnesium taken together are good, and GABA, GABA, has been known to help for some people. You can do some research on the internet to see if there are other treatments, and maybe visit a practitioner for help with this. Some people know they have restless legs. They have it when they're awake. Their legs are restless and they have to move them around regularly. Calcium and magnesium, or CalMag drink mix. It's a powdered mix, and you can turn it into a drink. That is useful often for people who have restless legs when they're awake. If you have trouble falling asleep or you wake up in the middle of your sleep, this can be a problem. Again, it leads to lack of sleep usually. Drinking alcohol, that can cause one to wake up in the middle of your sleep, commonly like 2 o'clock in the morning if you drink alcohol too late. And if that's the case, obviously you just shouldn't be doing that so that you can get a good night's sleep. It can cause the blood sugar to spike, making you feel energetic in the middle of the night. So the best way to avoid that is just to avoid drinking at a late in the evening. There's something called bruxism, teeth grinding, and that has been associated with anxiety too. You can maybe get that treated by visiting a physician, or perhaps a dentist might be able to help with that as well. There are many aspects of lifestyle to consider when one is trying to eradicate or improve sources of anxiety. Exercise is something that has been shown by studies to reduce anxiety levels, and especially if done regularly. Walking, running, weightlifting, working out in the gym. Reducing smoking, since nicotine can cause anxiety. Reducing smoking is actually, or eliminating it, can help. Of course, that is more difficult for people with anxiety because they often smoke to reduce anxiety. But it can help if you quit. Addictive behaviors can be a source of anxiety for people because they are in a constant state of anxiety, waiting for their next fix, you might say, of whatever they're addicted to, and that can cause nervousness. And then sometimes if they're addicted to a substance like a drug, the drug itself can be a cause of anxiety. So this is something to consider if you've got a chronic or recurring anxiety situation. Computer and internet addictions have been studied and have been shown to cause an increase in anxiety levels as well. Of course, personal behavior, the people that you hang out with, the types of things you do in your life, things that make you feel bad or feel guilty or cause you to worry a lot. These are things to consider that may be adding to your anxiety levels. Spirituality, for many people that don't think about these things, it may not be an issue, but for many people, there are a great many people who do think about these. They worry about if they're a good enough person, or if they're close to God, or if they should be going to church, or there are other issues of spirituality that bother them that they should, hopefully they can get addressed, maybe talk to a spiritual advisor to get some assistance with. High-risk behavior, if you're involved with anything that is dangerous or that can put you at risk. This could be gambling or risky investments, risky sexual behavior, anything that puts your life in danger, something like that. This can obviously cause you to worry regularly or even get into situations that are threatening, and that can obviously add to anxiety levels. And lastly, time in greenery is very useful. If you live in an apartment constantly, you never get out, you're gonna not get that exposure that our bodies kind of naturally need to be around green things. We're kind of made for that. So time in greenery can help reduce anxiety levels. There are metabolic issues which can cause anxieties, and these are very common, by the way. So if you're having a chronic anxiety issue, these should be tested for. It's important because these are very common causes of chronic anxiety. There are conditions called undermethylation and overmethylation. By the way, all of these can be found at the website at the bottom, walshinstitute.org. Dr. William Walsh is one of the pioneers of these, and his work and his predecessor, Dr. Carl Pfeiffer, go back about at least 50 years from now. Actually, it's been going on since probably the 1960s. And there's undermethylation. The methylation is a process whereby there are groups, chemical groups in the body called methyl groups, and these are transferred within the cells millions of times a second, and you can have a lack of methyl groups or overmethylation, just too many methyl groups. and these both can cause anxiety problems. There's something called pyrrole disorder. Pyrroles are a chemical that are released during hemoglobin metabolism. Hemoglobin is part of the blood cells, and when pyrroles are released, as they come out of the body and into the urine, they bond to B6, vitamin B6 and zinc, and they tend to strip these out of the body and can cause anxiety problems because of that. And zinc deficiencies can cause anxiety problems. Too much copper in the body can cause this. All of these are very treatable through nutrients therapy, and it's not very expensive. But more information, you can see go to walshinstitute.org. You can get these tested, by the way. There is a website called pyrolureatesting.com. The lab there tests these without a prescription. Obviously, stress causes anxiety. I think that's pretty universally known. Low stress tolerance can come from trauma or physical issues. A lot of times people think they're stressed out when actually it's just their tolerance is low from other things. And so that's an interesting thing to consider, very important, because if that's the real reason, you want to treat the real reason. Obviously, stress can be job or family related. Anything that overwhelms a person can put them in a state of chronic stress or frequent stress. Poor personal behavior, as we've mentioned, such as risky or illegal activities, can cause this. Financial issues, obviously. Having to work while a person is sick or fatigued can put them in a state of chronic anxiety or overwhelm. And losses or failures can cause these. So it's good to consider these things, that sometimes what's going on is clouding the person's judgment so much they can't quite spot it. So it helps to kind of look at these list of items or similar items that might be contributing to the sense of anxiety. There are many environmental things that can cause stress. Environmental threats. This could be like in a war zone, or it could be a woman with an abusive husband, or a kid going to school where there are bullies threatening to beat him up, that sort of thing. Lots of different situations where there are threats. A person who's constantly afraid of losing his job. Many types of threats that can cause chronic stress. Negative people can tend to cause one to feel nervous or under pressure or not too good, so it's good to stay away from negative people if possible. As we discussed, a lack of greenery in the environment makes one feel not as good, so it's good to be around, or at least certainly get periods where you can get some time in greenery. Any source of allergy in the environment, even air pollution, can increase the sense of anxiety and stress. So it's good to, if you're allergic, to avoid those sources, or to also consider that you may have some allergy sources that you haven't spotted if you're having chronic anxiety attacks under certain circumstances, such as after you've eaten a certain thing or been exposed to a certain potential allergen. Toxins. There are certain toxins, chemicals in the air that are even in certain water supplies that can cause problems, so be aware of those. Electromagnetic fields is something that's been studied now for a while, and it's been shown for some people, not all, but some people are highly sensitive to this, and you may be one of those individuals. So if you've noticed that when you get away from, like out in the country and get away from a lot of electromagnetic fields, that you feel better, that may be something to consider. There are people who work around, it's been known that electrical workers have double the suicide rate of the average person. So it's believed it's because they're exposed to electromagnetic fields. So some people are sensitive to this. And if you live near a power station, for example, or a lot of highly charged wiring in your neighborhood, and then when you get away from it, you feel better. It's something to think about. Believe it or not, there's something called geomagnetic storms. These are solar flares of the sun, and studies have clearly shown that there is a higher increase of suicides when these geomagnetic storms are greater. It's not a huge increase, but it's definitely a significant one and a noticeable one. So again, some people are sensitive to this, and everyone is different. So while many people would think this would be an unlikely source, there are going to be individuals for whom this matters. So that's something to think about. Treating anxiety symptoms, of course, typical psychiatric treatment is medication and tranquilizers. But for alternative treatments, we want to look at other things. Exercise is very common. That could be walking or jogging or weightlifting, depending, or any kind of working out at the gym, swimming, whatever the person finds works best for them. It should be done regularly. That's the best way to do it. It raises endorphin levels. These are chemicals in the body that make you feel better and can reduce one's sense of stress and also increase your stress tolerance. One thing that's not on here, I think, in this list is also cold showers. Believe it or not, hydrotherapy has been shown for some people to improve their ability to tolerate stress. It has a hardening effect. It sort of improves their ability to sort of deal with a jolt. Not everyone, but it has had some effect for some people. Amino acids, there's several, GABA and DLPA have been known to reduce stress. There are herbs. Many herbs have been tested, and you can find them in the medical journals to have had a positive effect on anxiety. Kava, valerian has been used for centuries, as has passion flower. There are others as well you can find on the internet. Calcium and magnesium as a combination. These are elements that work in the muscles, and the muscles use these to relax, and therefore calcium and magnesium together. I think the citrate form is the calcium citrate, magnesium citrate is more absorbable. But if you can find a calcium and magnesium powder that's used as a CalMag drink, that's often effective too. And usually calcium is, you take twice as much calcium as to magnesium. So like if you're taking 500 milligrams of calcium, you would take maybe 200, 250 of magnesium as a balance. And that's a great muscle relaxant. It can get rid of restless legs in like 30 minutes, or if you have a sense of nervousness, it can really relax you. Very useful. Neurofeedback is very helpful. This is like a simple way. Usually they use electronic screens where your mental energy, your brain energy is being measured, and you can sort of learn to bring that brain energy under control by watching the screen. Mindfulness, this is meditation. There are other ways, just being in the present. I mentioned in a previous video that the work of Eckhart Tolle, that's Tolle, he's got a great book, The Power of Now. That's very useful. Anything on meditation, there's lots of studies showing meditation helps anxiety. Yoga and breathing exercises. Breathing has been very well connected with calm and the ability to breathe. If you can't breathe freely, has been shown to cause anxiety. So breathing exercises, again, you can find a lot of information on the internet, can often bring anxiety under control. Very effective for this. Yoga is also excellent for relaxing the body. It's good for general fitness, and it's one of my favorites. And between yoga and breathing and maybe adding in some mindfulness, it could really help a lot to make one feel calmer. Chiropractic adjustments can be helpful. Sometimes one has restrictions in the body that are loosened up through chiropractic that can help you breathe better, open up your rib cage, make you feel more relaxed. There's a device called the microvolt stimulator, which has been shown to reduce anxiety. You can look on the internet for those. There's been studies with that. Adrenal support is good. Sometimes when your adrenals are overworked, your adrenal glands, you can feel exhausted and a sense of anxiety about it, or when you're getting a lot of an overactive adrenaline, then you feel too much at one time. So you can go online and look for how to support the adrenal system, and that could be helpful to you. Epsom salts baths. This is 2 cups of Epsom salts is a typical way to do it in a hot bath. You soak for 15 or 20 minutes. Incredibly relaxing. A terrific way if you're having trouble falling asleep. It can be a real or if you've got a panic attack going on. So it can be very great, very good for reducing agitation and anxiety. These are some. There are actually more. If you look online for alternative treatments for anxiety, you can certainly find more. One particular form of anxiety is OCD, obsessive compulsive disorder. This is a debilitating condition for many people that just controls their minds, or that they can't stop thinking about something, or they have to repeat the same action, and it can be really hard and make life difficult. A big issue to look at this is certainly look at methylation issues. Again, this is the Walsh Protocols we talked about earlier at WalshInstitute.org. That should be definitely looked at, get that tested and treated, and that could possibly eradicate the situation. Increased serotonin for some has been very helpful. This can be done with 5-HTP and tryptophan. For some, inositol, there's been studies showing that inositol is one of the B vitamins, or it's related to the B vitamins, and it has been shown to improve OCD symptoms for some people. Probiotics, these are flora that are microorganisms that grow in the gut and that live there, and some people don't have the right ones or enough of the right ones. And adding probiotics to the diet either through supplements, yogurt, that's food. There's certain sauerkraut and other foods, fermented foods can help. Can definitely, for some people, it's been known to eradicate OCD symptoms if it's the right ones. And it can certainly improve it for other people. It's great for health in general. We've already discussed calcium, magnesium. That is a great relaxant for helping people with OCD. Again, mindfulness has been shown for some people to be very helpful. Yoga, there is actually it was a study mentioned at the internetyogi.com. They show some exercises there, or you can buy some. They're quite reasonable. Some exercises that have been shown to reduce OCD symptoms by as much as 50%, I believe. And you can also go on YouTube and find plenty of yoga exercises that might help. There are breathing exercises that can help reduce the anxiety. Sometimes if you can reduce the anxiety, you can also reduce the mental obsessiveness about OCD. So that can be a way to sort of enter into that, reducing those symptoms. Neurofeedback is a tool that sometimes people use. We've already discussed that. And St. John's wort is an herb that has been used by some to improve OCD symptoms. Our basic recommended approach is to get a full searching history and medical exam. Again, you could have medical issues causing these problems, and that has to be excluded before looking for anything else. If nothing shows up on that, or that doesn't fully resolve the problem, then full testing per the Walsh Protocols, as we mentioned before, for methylation problems, overmethylation, undermethylation, and the other issues. That is certainly a very common cause of chronic or recurring anxiety or OCD issues. Then treatment based on the above, and if that does not do it, or if you are in the middle of treating but it's not fully recovered, then definitely symptomatic treatment. We've given a list earlier on treatments that can be used, supplements, herbs, lifestyle changes, and that sort of thing. Use those to bring down the symptoms. And lastly, if possible, withdraw off the meds under supervision, medical supervision. Often, after going through this particular procedure, people have their symptoms under control or eradicated even, and they really don't need the meds anymore, and are able to, under a doctor's care, to get off, wean slowly off the medication they've been taking. So to wrap it up, realize that anxiety is the symptom. It's not a condition. It's not a disease per se, and it can have many causes. It can have multiple causes, in fact, in one individual. And it can have multiple physical causes in one individual, as well as other types of causes. The causes may be obvious, or they may be completely unknown to the person, and they have to be looked for. It helps to get outside help often to help find what it is. Try to find the causes and treat them, and in the meantime, treat symptoms with safe treatments as possible. We hope this has helped, and we wish you great success on your road to a happy and healthier life.